Good night, everyone. Welcome to one of my webinars. I want to thank, first of all, brightbud.com for sponsoring these webinars. I would like to remind you that throughout the presentations, your microphones will be muted, and I will give you some time at the end of the presentations to ask me some questions. You know, it's my favorite part of the presentation. This webinars come from my medical experience, but I would like to remind you that they don't replace a medical consultation. If you have any questions by the end of the webinar, or maybe you're not watching it live, you can go into brightbud.com and record a video question, and I will go ahead and record a video answer or give you an answer. So let's begin. So tonight we're going to be talking about osteoporosis and osteopenia. For those of you who are new and do not know me, my name is Jaime Mesa. I'm a medical doctor. I work with chronic conditions such as this one. Let's begin. I like to always start my presentations with some numbers. In this case, I'm going to call them quick facts. It's very important for us to know that about 55 million Americans are at a higher risk of having a bone fracture. And those 55 million need to be concerned about it. We all are in risk of ever having a bone fracture, but these 55 million people are in really high risk. Of this 55 million, 11 have osteoporosis, and the remaining 44 have low bone density. 1 in 2 women and 1 in up to 4 men will have a bone fracture due to osteoporosis in their life. So that's very high. Half of women will have it, and almost 25% of men. If we combine breast cancer, heart attacks, and stroke, that won't even get close to the number of people that will have, or at least women that will have osteoporosis. So if breast cancer, heart attacks, and stroke are important, this is really, really important. I'm gonna give you, since my last presentation, I started doing some, this part, which are amazing facts, and I think they were really good. So I will try to do it in my next presentation. So this is a very amazing fact. Bone is not really as solid as we think. Actually, bone is more like a spongy material. There's a part that are called trabeculas, which are like columns or rods that create the whole structure of the bone. And of course, we're talking about microscopically. These trabecula are the solid part of the bones. And between those bony parts, really we have soft tissue and, let's say, air. So bone actually looks more like a sponge. It's not really as solid as we think, which is amazing. Also, this solid part of the bone, it's constantly being like eaten out by a group of cells that is called the osteoclast, while another group of cells that are called osteoblasts are replacing this bone. So in reality, bones never get old. Actually, every 10 years, the entire surface of the bones is replaced. So even if we are 80 years old, you can still have 10-year-old bones. So bones never get old, and that is actually very amazing and pretty much a fact that nobody knows, or very little people. Here's a little picture of these two groups of cells. You can see there in pink the osteoclast that is basically like eating the bone, and then in blue the osteoblasts behind them rebuilding this bone. Pretty amazing, right? So what is osteoporosis and what is osteopenia? Well, first of all, now we define both of them as chronic metabolic conditions that ultimately affect the bone. as a result of these conditions, there is a loss in the density of the bone. Osteopenia is a precursor stage, a previous stage prior to osteoporosis. So basically, they are caused by the same, they come from the same place, but osteopenia is just a stage before getting to actual osteoporosis. There are multiple causes for low bone density, but basically there are two main causes. Number one is that bone density peaks between ages 20 and 30. So that's when we have the highest bone density ever. But if we never build up enough bone density by then, because we didn't have enough calcium in our diets or vitamin D or any other malnutrition or not enough exercise, then it'll be easier for us to develop low bone density, first osteopenia, and then end up in osteoporosis. So that's number one. People who never got enough bone density when they were in their 20s, that's why that's what causes osteoporosis and osteopenia. And number two, an imbalance between bone formation and resorption. As I was showing in the amazing facts, well, bone is always being changed, eaten away, and then rebuilt by some cells. If there's a little imbalance in this process, of course, we may end up either with too much bone or with too little. And of course, what is more common is actually having too little. So this is number two cause of osteoporosis. Of course, this is not a condition that is caused by one thing. It's factorial. So that means many different causes end up in osteoporosis, but these are the two most common. When we're talking about the imbalance between resorption and formation of bone, it is very, very important that we talk about the role of estrogen in this process. And why is it important? Because women are more affected than men by osteoporosis, and that's because after menopause, they lose that protective effect of estrogen. So of course, estrogen normally increases the concentration, decreases the concentration of osteoclasts. I mean, low estrogen produces low concentration of osteoclasts. Low estrogen produces more concentration of osteoclasts, which are the cells that eat the bone up. So of course, we're going to end up with low bone density. And of course, aging also leads to a decrease in the osteoblasts, the cells that actually build up the bone. So that's why women, because of the estrogen, suffer from osteoporosis, and age is another risk factor. So these two contribute to that second cause. So what are the risk factors? Of course, by now you should figure out two of them, but basically this picture here tells us the typical risk factors and the most common. First of all, white people, Caucasian people, they're at increased risk. Some also Asians, but mostly Caucasian people. Women, they're because of the estrogen, like I was telling you. People 45 years and older, and smokers. So these four are the most important risk factors for osteoporosis. There are many others, like dementia, like low weight, dangerously low weight, and being a sedentary person. I mean, lying all day in the couch is gonna definitely affect your bone density. What are the symptoms of osteoporosis? And this is something that is really important because people ask about this all the time. as many other conditions, unfortunately, osteoporosis is a very silent condition. So there are not many symptoms, at least not when the osteoporosis is starting. When we have osteopenia, probably there are not going to be any symptoms. As bone density begins to decrease, then the normal spine that's supposed to have certain shape will start to get kyphotic, which means that you're going to have that little lump on your back because the shape of the vertebra begins to change, and then the spine begins to have a bigger curvature. So that's one of the symptoms. Of course, this at a certain point is normal because, as you might know, with age, as I mentioned before, we lose some bone density. So all of us will shrink a little bit throughout our lives. So we will end up being shorter. But then having that process, which is very notorious, having a very big curvature in your spine, that's a symptom of osteoporosis. And certain pain, but we have to clarify that most pains in the bones are not really because of osteoporosis. Like I was telling you, it's very, very silent. But there are some that might be because you are starting to develop small fractures, especially if you had trauma. So of course, pain in your hips and pain in your back might be sign that you are having those fractures and that maybe you should be checked. How do we diagnose osteoporosis? Well, of course, we take those risk factors and we try to use diagnostic tests in people who have risk factors, but mainly in women, although men should do it too. But DEXA scan is the most used tool to diagnose osteoporosis. It's a screening tool, but it's very good as diagnostic. Basically, what we do is that you go into a scan, which is X-rays, basically, and they shoot the X-ray beams at two specific places on your body. One is the one vertebra, and the other is the femur. Those are two standard places we use because we know we have conducted studies and we basically know what the normal density of that bone should be. So and it's a very good place to do it, a big structure to point the X-rays. So some of you might have been there. You see the bed there and the X-rays. It's kind of sometimes uncomfortable because you have to lay down and stay still for a while, but it's harmless, it's painless. So it's a very good tool. Basically, they're going to give us a lot of information, but two specific things. And maybe if you have a DEXA scan result, you might see it. You will see the C number and the T number, or percentages. Basically, what they do is they compare your bone density to the bone density of a normal person between 20 and 30 years old. So that means your bone density compared with the best density possible. That's the C score. And then the T score is compare your bone density with the bone density of the average density of the population, your sex and your age. So basically, we have certain scales, but then if you're losing a little under one, -1, the C number, you have osteopenia, and under 2.5, you have osteoporosis. There's some other tests that we do, like blood test measuring vitamin D in the blood. And unfortunately, sometimes, probably more than we would wish, we diagnose it when we have the patients on the ER after bone fractures. Usually after a minor fall, they develop hip fractures is the most common, but also wrist and spine. And some of these people don't even notice they have a fracture until days or even months. And I've seen people with fractures over years that they never noticed. How do we treat osteoporosis? Well, of course, when we're trying to prevent osteopenia to become osteoporosis, we might start telling you to increase your calcium and your vitamin D consumption, your intake. Of course, it's very widely known that dairy has a lot of calcium, so of course that's very recommended. It's not the only thing we do, but it's a good recommendation. Number two, it's by exercise, but it's not the same exercise as for heart conditions. It's not the cardiovascular. Actually, in this case, lifting some weights might be the best exercise because bone reacts to certain stress. So when you lift weights, those little structures, and remember I told you the bone is like a little sponge. When you squeeze it, you make some little breaks on those structures, and then they grow back stronger. So that's why we recommend this kind of exercise for you to increase your bone density. Of course, calcium plus vitamin D. And for certain people, especially with a very bad, dangerously bad bone density, hormone replacement therapy would be appropriate. Of course, we have to remember back then when I gave the breast cancer webinar on the endometrial cancer, that sometimes this hormone replacement therapy increases the risk of developing one of those cancers. So of course, this has to be given to the right patient and be monitored in the right way. But it is also an alternative. There are some kind of medicines that we call the biphosphonates, which directly act by inhibiting the actions of the osteoclasts. We use them. We have many different. Some of them are taken weekly. Some of them are taken monthly, and now there are medications that are taking more than one, lapses than more than a month. And we have some others that are used every 6 months, including some medications similar to this, which are the biologicals. And probably I'm going to talk about this in almost every webinar, because now the biological agents are being created for almost any condition. In this case, this biological medication, which is injected, also acts in the osteoclasts by creating antibodies against some of the proteins there, so they cannot do the effect. It is also a very good medication, but of course this is reserved for people that have very bad osteoporosis. It's not first line treatment. Then one of the most important questions and one of the most common question is, why is vitamin D so important to osteoporosis and calcium itself? The answer is that vitamin D plays a crucial role on the calcium metabolism. Basically, it controls the absorption of calcium, the transportation of that calcium from the gut to the bone itself, and then how much of that calcium we actually excrete. So it is very important, because even though you are consuming calcium, if you don't have vitamin D, then it will be good for nothing. Vitamin D works as a hormone, basically, and it controls also bone resorption. That means the eating out of the bone. And we have to remember that vitamin D is actually produced by our bodies by a reaction that starts in our skins with the help of sunlight. So it is a very good thing to receive some sunlight once in a while, because there we are creating vitamin D. If you read about it, there's not a recommendation about how long should you receive sunlight every day to have an appropriate level of vitamin D. Why? Because as sun rays increase the chance of getting skin cancer, then we are not very confident, and we feel that is not good to actually recommend a certain amount of time. But I'm pretty sure if you use a sunscreen and you don't burn your skin probably about 20 minutes or 30 minutes twice a week, that would be a good recommendation to do it. People ask also if there's a possibility of actually producing too much vitamin D if you are exposed to too much sunlight, and the answer is no. Actually, the body is perfect, so you can receive all the sunlight you want without producing too much vitamin D. As I said before, you might increase your risk of having skin cancer, but you're never going to have toxicity or intoxication for excess of vitamin D because of taking too much sunlight. Of course, we do get vitamin D from other sources like food. We can get too much vitamin D there, but not because of sunlight. Okay, thank you very much. I hope you liked it, and I think this is going to be a very interesting topic. Now it's time for your questions. Thank you very much again.
Dr. Jaime.
Yes.
With reference to that last bullet, or that last slide that you showed, so I just thought of something. Does sunscreen, does that in any way retard or slow down the reaction of your body when it's producing vitamin D?
Yes, because basically it needs UV rays, UV light to do that procedure. So of course, if you use a sunscreen that is 100 SPFs, then of course that's gonna definitely delay or actually stop the whole process. But if you use a sunscreen that is not that much protective, I mean, it will let some UV light go through, and that will be enough to create enough vitamin D. So it's again kind of a dilemma. If you want to be protected for cancer, but you still want to have vitamin D. So I guess it's a matter of playing a little bit with what type of sunscreen you're going to get and how much sun are you going to be exposed to. So probably a 26 SPF, 20 will be good. It will still protect you against the skin cancer and will still be good enough for you to produce enough vitamin D.
Okay, thank you. Another question, sir.
Yes, go ahead.
In terms of the calcium that you would take to offset your or delay or retard the onset of osteoporosis, would you recommend like over-the-counter calcium, multivitamins, that kind of thing?
Well, yes, but of course everything, even if it's supplements and vitamins, has to be always monitored by your doctor. Why? Because, for example, let's take calcium. Calcium nowadays is recommended for many different populations, different ages, but now after 45 it's very recommended. But we have discovered that too much calcium, it's actually bad for your heart. It increases your cardiovascular risk. So we have to like level it up. And now we have the means to measure the vitamin D in your body. So we try to play this, and let's see how your vitamin D is, and let's see how much calcium you can take. Of course, taking more than 4,000 units increases your risk of having heart problems. So the recommendation would be 1,000 and between 1,000 and 1,200. It also depends on your age and if you're male or female. So I do recommend it. You can take it, but then also tell your doctor so he can monitor the amount you're taking and with your specific conditions.
So maybe you pay attention to what they put on the containers, the recommended daily allowance. That might be something for you to pay attention to.
Yes, because there's so many different type of multivitamins and supplements, and they have very different amounts of calcium and vitamin D. So yes, it's better to pay attention and to buy the ones that are suitable for you between those concentrations, of course.
Okay. And one last question, sir.
Yes.
I run on I jog, you call it, on weekends. And I know that the benefits of the cardiovascular is great, but I've often wondered if I'm not maybe doing some damage to my bones in the long run. No?
Well, I don't think you're doing any damage to your bones. Actually, probably you're doing good. Of course, like I was telling, a more appropriate type of exercise for bones would be putting some weight, either by doing actually weightlifting, or simply you can do the same job with some weights on your hands, on your arms, and your legs. I don't think you are doing bad, but there's definitely you can mix a little of those two types of exercises so you can actually do a little bit more for your bones. But I don't think that's going to do anything bad to your bones.
Great. Thank you, sir.
You're welcome.
Dr. Mesa.
Yes.
So having too much calcium is not bad for your bones. Is that correct? Having too much calcium in your body is not too bad for your bones?
It's not too bad, but it is bad for your body itself, not for the bones. But calcium, it's an electrolyte also. So that means it is part of many other processes, including, for example, contraction of the heart muscle. So if you have too much calcium, and not only the heart muscle, every muscles in your body. So for example, if you have too much calcium, you might start getting paralyzed, or you might have heart arrhythmias. So of course, taking too much calcium, it is definitely toxic, and you shouldn't do it. Normal kidneys will get rid of this calcium, but of course, to a certain point. If you have too much calcium, too many, you're gonna definitely have it's gonna be very dangerous to you. And also concentrations of calcium that are not so high that to produce toxicity, but in the long run, chronically, they will produce, or they increase the cardiovascular risk for both strokes and infarctions. So you have to be careful. You do need a little calcium because people don't get enough in the diet, but you have to be careful not to take too much.
Okay, I have another question. So it's recommended that if you take calcium, you should be taking vitamin D with the calcium also.
Yes.
That is correct.
That is definitely correct.
Okay. One more question. So I've heard of a heel tap that you can do to test for osteoporosis. Is that a good way of checking? Yes.
I would say it's better to do a regular DEXA scan either in your vertebra or your femur, or both. There is that test that it's usually used like in mobile stations for when they do fairs, or they go around the whole city testing people. They can do it, and it's reliable. But I prefer myself to have the DEXA scan done. It's also used, and I didn't include it because I like more the DEXA scan. It gives us a little bit more information. But if that's what you got, it's useful also. Yes.
Okay. Well, thank you.
You're welcome.
Dr. Jaime, you said that you can have too much bone.
Yes.
What happens to the extra bone?
Well, of course, that's a very rare condition. And I said bone because that would be a simple way to saying it. But of course, what I really meant, we have to understand that bone, as I said, is a structure that's made of very different things. Not only calcium, actually. We have phosphate in bones. We have collagen in bones. So what I really meant is that we can have too much calcium in the bones, because bones have to be strong, but they also have to be a little elastic, because otherwise they will be very brittle. They would be like glass. So when we have too much calcium and the body is able to put it in the bone, we will end up having, let's correct what I said, not too much bone, but too much, a not so elastic bone, a very, very brittle bone, because it's going to contain a lot of hard structure. So it should have like a balance between collagen and some other proteins and calcium and phosphate. Having too much will make the bone like glass, basically. That's what I meant.
Okay, so you said what happens to it? The extra, does it get passed out, or how do you get rid of it?
Yes, yeah, definitely. The kidneys have that function to determine how much calcium are they going to do, and also remember vitamin D in a certain way controls that. So in a normal person, basically we will pee the excess of calcium, and that's why in some people it will end up actually producing kidney stones. They are made of calcium, so some people that are peeing too much calcium end up producing kidney stones. So in a normal body it doesn't happen, but in some people it might. So yes, kidneys are in charge of regulating too much calcium. So basically you will pee that excess of calcium.
Okay, thank you.
You're welcome.
Dr. Mesa, I find it quite fascinating that the bones is sort of a spongy material. And with that in mind, is it telling me then that it reproduces all the time? Because you mentioned that even in an 80-year-old, that the bone can represent that of a 10-year-old. So is it say something to do with reproducing, or should I say revitalizing itself all the time?
Yes, definitely. Bone is a very important structure. All the body is based on this structure. Everything around muscles, tendons, nerves are around the basic structure, which is hard, which is the bone. Of course, we have to renovate it, because if we don't, then that bone's gonna go bad and you're gonna have fractures all the way all the time. So yes, every 10 years or so, something like that, all your entire bones, it's considered that is new. So you never have old bones, actually. It's very interesting. And yes, it helps the renovation, because it's easier to renovate little structures, little pieces like columns in the bone, that to renovate a whole solid structure. So yes, it's very, very, very fascinating. I guess it's the best example, or one good example, of why the body is so perfect, or how the body is so perfect. It's also interesting to know that when women are pregnant and they don't pee that calcium as much as they used to, because they are using that calcium and phosphate and some other things to create the fetus bones. So actually and literally, the baby is made out of your own bones, which is also a beautiful and very interesting fact.
Wow,
I know.
that is amazing. So that is telling me that me as a whatever over 50-year-old person, that I should be able to do things that a teenager can do.
Well, as long as you have the same
With
bone density, yes, of course, definitely.
okay, all right,
Sometimes age is just a number.
yeah, that inspires me to take up some sort of different exercises now.
Okay, Very, very good.
Thank you. Thank you.
You're welcome.
Dr. Mesa,
Yes.
you said that the bone is very spongy. Now, is this the reason as you get older, some people get scoliosis?
Yeah, well, normal bone is spongy, but let's say that it's basically solid structure with holes, like a cheese, let's say.
Uh-huh.
The bigger the holes, less of the solid structure you have, so the easier for that bone to break. When you have low bone density, that means you have a lot of holes in your bones, so they start fracturing, but at a microscopical scale, so they will start to actually shrinking, and that will end up causing scoliosis, and more than scoliosis, kyphosis or kyphosis, which is the curvature of the spine getting more and more. So that's why when you get old, you start having a little hump on your back, because that's what happens. It can also cause scoliosis, which is the same curvature, but not like this, but side to side. It can also be caused by osteopenia or osteoporosis. Yes.
Another question. Then why is it a young person in their teenage years would suffer from scoliosis?
Now it's not very common to see children with osteopenia or with definitely not osteoporosis. There was a time, and there are certain countries, unfortunately, in which there is still a lot of children with calcium and vitamin D deficiency, so their bones are very, very soft, so they become very like Play-Doh, including the spine, so that might be one of the causes. But here, that's not very common. What's most common is either having muscular problems, because muscles are attached to those bones and they pull either to one way or the other. So if one muscle is weak, the other one will end up pulling to that side and creating that curvature to that side. Also, another cause for that, and it's surprisingly common, is just bad habits when you are sitting down. If you don't have your back in a straight line and you're just trying to do this or this, if you are a kid and you're still developing your bones, then your spine will be crooked. And that's very, very common. That's why there are a lot of occupational health hazards, especially in schools, so they change the seats so they can sit straight and not crooked, because that's a very, very common, I would say, number one cause for scoliosis in children.
The reason I asked that question, 3 years ago, my 12-year-old granddaughter had to have spinal surgery to straighten her spine. She has 4 rods in her back because the spine was coming in an S shape.
I understand. Yes, well, it might be because of osteopenia. It's not very, very, it's not very typical. I'm not really sure in that case why it was, but sometimes it's just because of the position of your body, and with years, if you don't treat it, it will get more and more and more bent until it makes that little S shape. And at the beginning, it's easily treated with physical therapy and with braces, but if it gets to an angle, a certain angle, or more than that, then it has to be corrected surgically, like in the case of your family member.
Yeah, because she did have 2 braces, but they didn't correct it, so she had to have the surgery.
Exactly. Sometimes that happens, unfortunately.
I have a question. I guess the first question is, when the bones become, when the density, when it's not very dense, it can affect all of the bones in the body, correct? Even though we test in the vertebrae or we test in another part, it affects all bones equally, would you say? Or are there certain areas that are more likely to become less dense quicker?
Okay. Well, definitely it affects all the bones, but they're not affected equally. The reason behind this is because we actually have different kinds of bones. I didn't mention that because it will be another whole topic, but we have long bones, even when not all of them are long, but we call them long bones, like for example, the femur or the bones in our arms, or even the bones in our fingers. They are called long bones. But we also have some other types of bones that are not long, and they don't have exactly the same structure. Basically, and microscopically talking, we also have different bone structures. Not every bone is definitely that spongy. So the bones that are mostly affected by osteopenia and osteoporosis are the long bones, like the femur. But that's why we test those bones. Although the other ones are also affected, the consequences are not that severe when the other bones are affected. For example, the skull. The skull is flat bone, it's not long, it doesn't have the same structure, so even when we lose a little bit of bone, it's not going to be that bad. Of course, the explanation might be a little bit more complex, but the answer is yes, they're all affected, but since we have different bones, some of them are affected more than others.
And are there any other lifestyle changes that that people can adopt, specifically cancer patients, because we know that many of them can't take anything with estrogen in it? And you just said that when there's not enough estrogen, the bones become weak and they break. So if they can't take estrogen, what could they do? What can they do?
Well, of course, the other lifestyle changes they can still do, increasing the calcium in their diets, taking vitamin D supplements, and they can still go and have some sun at least twice a week. For them, we would have to evaluate the kind of physical activity they're doing, because that would be a really good thing for them to do. Of course, it depends on what type of cancer and in what stage is it, because of course there are certain patients that are not able to do physical activity, especially not weightlifting, definitely. Some medication would be good for them a little bit. Of course, we have to take into account every medication that they're taking, but probably for those patients, medication would be considered, especially biphosphonates. But as I'm telling you, it's very difficult to give a recommendation for these patients, but maybe biphosphonates receiving it once a month or even once 2 or 3 months would be good for them, I guess. But
And
lifestyle is, yeah, go ahead.
Yeah. So, but as far as lifestyle changes, there's really not too much, would you say?
Yes. Well, not much, not very different from the normal recommendations of having a good diet and exercise. That's the only thing.
And what kind of doctor should someone see if they think they have a problem with osteoporosis?
That's a very, very good question. Osteoporosis is a very, very common condition, and I guess it doesn't have to be seen by any special doctor. A regular family physician should be trained enough to treat it and to know about it. But if you, as it's a metabolic condition and let's say endocrinological, you can go to your endocrinologist, and probably your family doctor, if your osteoporosis is severe enough, will end up consulting with an endocrinologist, and sometimes with your sorry, I missed the word, but your well, the bone doctor, sorry that I missed the word, your orthopedist, because of course they have to all see what is it that you need. But most common, you will be seen either by your family doctor or an internal medicine specialist, which is trained to treat chronic conditions, and with them, that would be more than enough. Very rarely you will need endocrinology consultations.
Thank you.
You're welcome.
Yeah. Yeah, I'm in a webinar. I'm in a webinar.
Okay. Well, thank you again. Thank you very much. Your questions were amazing. I really enjoyed them. I hope you enjoyed the presentation also. And you meet me next Thursday for our next webinar. So thank you very much, and have a great night.